I'm Nicola Headland.
And I'm Jacqueline Duffy. We're assistant speech and language therapists working in the intellectual and developmental disability services. Although we're full-time in the speech and language therapy team, we are very much split across different services across Nottinghamshire. So I support a locked rehabilitation setting, our interactive approach service and our communication aid service.
I also support in the Specialist Services Directorate within a community role, working within the CIDT, and I also work in the forensic services on the male IDD ward at Wells Road Centre.
I never know where to start when describing a typical day. Every day is different. Usually starts with a coffee and a friendly smile from one of our colleagues. But the job includes making communication guidelines and gathering information for those. We might make communication resources and easy read information, or we might support with facilitating training. We often need to liaise with other carers or other colleagues of different professions in order to gather the right information for what we're producing, and that helps to put our communication needs and link that with real life experiences, which is more meaningful for the service user.
In addition to our usual roles, we're also involved in developing information in an easy read format, and this goes across the trust as a whole. Just recently, this has been very COVID focused. We've been looking at how services have been impacted and information that service users need to know about this, both parents and carers as well. We've also been looking at the restrictions and the guidelines and how these constantly changing and how information needs to be provided for service users. We've also looked at how preparing people for vaccinations. We've produced vaccination packs with information and capacity assessment packs. And just recently, we've also been looking at improving the signage across the vaccination centres. Our main role within our job is to develop some tailor-made resources that are very specific to patients and their communication needs. This might support with their information, understanding of quite complex information. It might be resources to support them with everyday living skills and therefore promoting independent skills. Or it might also be just to enhance their communication skills and their experiences when communicating with partners. We will work quite closely with different professionals within the MDT. We support colleagues to think about inclusive communication, looking at their own communication skills when working with patients. We also look at simple communication approaches and techniques that all different professions can use with patients to enhance their experiences with them. I like to think that we're quite approachable and we're always there to offer support and advice.
What I like about the job is every day is different. I like the relationships that we build up with service users and their support networks and our colleagues that we work alongside. I like the fact that although we are a large speech and language therapy team and split across different services, we are a team. We support each other on the bad days and celebrate the good days.
I like the variety and the challenges that both of my roles bring within forensic and also within community settings. So, for example, I might be working with a nurse in the morning, working on some easy read information about medical procedures or conditions that they have. And then in the afternoon, I'll be getting stuck into a therapy session delivering that jointly with the psychology team.
So how we make a difference? Well, we are pioneers for inclusive communication, which is the heart of people's lives, their health and their well-being. And when you see the impact that the smallest of changes can make on a person's quality of life, that's quite a humbling experience.
So providing information in an easy read format and making reasonable adjustments can have a huge difference to somebody's life. So quite often by providing it in this way, people can understand quite complex and difficult information that otherwise receiving that verbally might be really quite difficult. And in receiving it in this way, it might enable them to engage more meaningfully with the information that's been provided. So an example of this is a recent piece of work that I've been doing within the hospital setting. I produce a weekly poster with updates about the changes and the ongoing guidance that's provided around COVID and activities. The information is provided in an easy read format for the patients on the ward, and it had been fed back to us that it was noticed that the patients were engaging really well with this and seemed to understand the information much more. So on the back of this, it was decided that the information would be provided in the same format across all the wards in the hospitals, and it's proving to be really successful and well received in that way. I think
that is a snippet of an assistant speech and language therapist.